And the biggest surge in daily COVID cases in India. India has reported 1,15,736 new COVID cases. That's the breaking news coming in. This is a record surge since the pandemic started. 630 deaths in the last 24 hours. These are some worrisome figures coming in, viewers. This has been the biggest ever surge in the daily COVID cases in the country. 1,15,736 new COVID cases. It is a record surge ever since the pandemic began. This is the second COVID wave in India we are talking about, with 630 deaths in the past 24 hours itself due to the coronavirus. We're getting you these latest figures on your screens right now. Extremely worrisome numbers coming in. The biggest peak coming in India, daily COVID cases since the start of the pandemic. Over 1.15 lakh daily cases in India. Let's get you a sense of the numbers. We're talking about record surge in COVID numbers in the country. On your screens right now, sources the Health Ministry. Active COVID cases in India as of 7th of April, 8,43,473. The numbers are rising, viewers. Let's take a look at the death figures. 1,66,177 as of 7th of April. The recovery on the brighter side have been quite stellar. People have recovered quite well. 1,17,92,135 have recovered from the novel coronavirus in India. But at the moment, the focus remains on the active cases. The active cases tally is a worrisome figure right there. 8,43,473 active cases in India. The India coronavirus crisis is worsening every passing day. India has recorded its biggest ever COVID spike on 6th of April. More than 1,15,000 cases reported, surpassing the tally of 4th of April, which was over 1,03,000. The centre has warned that the next 4 weeks are crucial to handle the strong second wave. Maharashtra continues to drive this surge in the country. The state has reported over 55,000 cases in 24 hours itself. With this surge, the active cases in the state has now breached the 4,70,000 mark. Maharashtra has also reported 297 deaths in 24 hours. Mumbai has clocked over 10,000 fresh COVID cases and 31 deaths. So far, 740 buildings in the city have been sealed. Delhi, on the other hand, has reported 5,100 fresh cases. This has been the highest surge in the national capital since November last year. Centre sent 50 teams of technical and clinical experts to 30 districts in Maharashtra, 11 districts in Chhattisgarh and 9 districts in Punjab to curb the spread of the virus and help the states in dealing better with the crisis.
Mumbai yet again recorded more than 10,000 COVID positive cases. The count of active cases in Mumbai is now more than 77,000. The doubling rate has further reduced to 38 days. The count of active sealed buildings in Mumbai is now 740. The Mumbai Municipal Corporation says it is now focusing on the various housing societies, which will be treated as mini containment zones. If they flout the rules, strict action will be taken. And if more than 5 people are found positive, entire society is going to be sealed. BMC staffers along with the police are going to keep a tight vigil and ensure that no rules are flouted by these society members. Section 144 is already in play in the state. Night curfew has already been imposed. Swimming pools, gyms, beaches, malls, shops, all are closed. Yet the cases in Mumbai keep on rising, and so does the death count. With camera person Rakesh Salaskar, this is Pankaj Upadhyay in Mumbai, reporting for India Today.
कुछ ही स्टेट्स में 11-12 स्टेट्स में ही हालत ज़्यादा विस्फोटक हुई स्थिति, चाहे महाराष्ट्र हो, आप दिल्ली की बात लगा लीजिए, क्या वजह क्या है, पंजाब है, तो उन्हीं स्टेट्स में क्यों?
देखिए, अब ये तो बहुत ज़्यादा जब डिटेल्ड एनालिसिस किया जाए तो उसके अंदर ये पता लगेगा कि भाई यहाँ पर जो है कोविड अप्रोप्रिएट बिहेवियर के अंदर जो है, मान लीजिए कोई ज़्यादा लापरवाही है या ज़्यादा सावधानियों को इग्नोर करने की बात है। लेकिन आप अगर ध्यान से देखेंगे तो थोड़ा थोड़ा आपको हर जगह पर जो है ना केसेस के अंदर इंक्रीज़ दिखाई देगा। लेकिन ये जो 80% से ज़्यादा केसेस हैं ये क्योंकि और जो मोर्टालिटी भी है और केस की वजह से बीमारी होना जिसको मॉर्बिडिटी कहते हैं ये भी जो है ये 11 स्टेट्स में ही ज़्यादा है। उसमें भी जो जैसा मैंने कहा कि पंजाब में, छत्तीसगढ़ में या महाराष्ट्र में और भी ज़्यादा है जहाँ की हमने स्पेशल टीम्स भेजी हैं।
वैक्सीन की प्रक्रिया इतनी गति से चल रही है उसको प्लीज सेलिब्रेट करिए। देश की जो अचीवमेंट है, अनयूजुअल अचीवमेंट, एक्स्ट्रा ऑर्डिनरी अचीवमेंट है, उसके तरफ हमारा ये जिम्मेवारी बनती है कि उसको उसी परिप्रेक्ष्य में कह के अपनी अचीवमेंट को लें और उसके साथ आगे बढ़े। और जब वक्त आएगा कि यह और खुलना चाहिए, जब हम अच्छे पूरी तरह से आगे बढ़ रहे हैं, कवरेज अच्छा देंगे तो वो भी हो जाएगा।
The states of maximum concern to us still remain Maharashtra, Punjab and Chhattisgarh. Maharashtra because of its share in the total number of cases as well as total number of deaths nationally, and Punjab and Chhattisgarh we will come to them because of their share in the number of deaths. Given their population, the death numbers that are being reported by Punjab and Chhattisgarh are a cause for extreme concern.
Speaking exclusively to India Today, Serum Institute of India CEO Adar Poonawalla has allayed the fears concerning the COVID vaccine Covishield. After the report surfaced of blood clotting following inoculation, Adar Poonawalla has said the data on clotting is going to be coming in by next week, and only scientific data will ascertain whether these blood clots have resulted from the vaccine or not. So that data is still expected. Moreover, he has hailed Covishield's efficacy and said that COVID vaccination is going to prevent hospitalization. Poonawalla has clarified that Covishield is not a bulletproof vest. It is not a magic bullet, and that an individual...
The Ministry of Health in India, the WHO, the EMEA and other countries have said that this vaccine is perfectly safe. Certainly here, the quantum of blood clots that have happened, we have to still establish and see if it's vaccine related based on the fact that, you know, blood clots is a normal phenomena in a given population of age and comorbidities. So the vaccine is providing excellent safety and efficacy. So we're seeing that 90 plus, 94% plus efficacy with even one dose of Covishield in India. No vaccine, whether it's Pfizer, Moderna, Oxford, AstraZeneca, is preventing more than 20-30% of the people who get it or are exposed to COVID-19 from getting the disease. They experience mild to moderate disease. So there is no vaccine, sadly, on the planet today for COVID-19 that prevents the person getting the disease. So far, what I can say with confidence is I have not seen anyone getting the UK variant disease who has been vaccinated and still ending up in hospital. So far, that is the silver lining. But to conclude this beyond reasonable doubt, we should wait at least another month or two till we see enough people getting the UK variant as a disease who have been vaccinated and then observing how severe the disease progresses in their body. That's why I called it Covishield. It's not a bulletproof vest. Imagine if you're shot with a gun, the bullet, when it hits your bulletproof vest that is supposed to protect you and save your life, is only a shield. It's still going to cause you some damage, bruising, maybe you might even break a rib, right? But you are not going to die. And hopefully that is the case, and that is now being shown as an evidence. And what is that? It protects you against severe disease, which can threaten your life 94-95% of the time, even after one dose, right? And you can look at the data which is coming out with Covishield will give you that protection. In fact, today, everyone from the time January to now, and now we've spent 3 months, you know, you've got, I don't know how many crore people, more than 4 or 5 crore Indians that have received one dose. let us now observe and see that are they being hospitalized or not. At the moment, the data we have, that minimum 7 to 8 months protection with the 2 doses, after the 2 doses are administered, is there. Now we have that data coming out globally. They'll publish it soon. So we know that for certain. Now, after 8 months, we don't know because the time hasn't passed. The real way of proving that, I mean, is, waiting for that period to pass. So we've got data from the Oxford AstraZeneca vaccine from the very early patients and trial candidates and others that were vaccinated, 7-8 months ago. So we're waiting to really know and answer that question as time goes on.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.